Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. Healthcare professionals across Scotland say patients with multiple long-term conditions are falling through the cracks when moving between care settings. A new study in BMC Geriatrics, based on interviews with 30 doctors, nurses, and social care leaders, found care transitions often lacked person-centeredness and consistency, especially for older adults frequently moving between hospital and community care. One geriatrician reported seeing patients admitted to hospital even when the documented wishes clearly stated the opposite. Communication failures were flagged as a major issue, with non-integrated IT systems leaving discharge notes incomplete or missing altogether. Workforce shortages and training gaps further complicate care, particularly when staff are trained in narrow specialties but not in managing patients with multiple conditions. Researchers conclude fixing barriers will require more patchwork solutions. They call for a systems thinking approach where patients, professionals, and policymakers all work together to create lasting improvements at every level of care. A new study suggests older Americans with dementia get better care when treated by doctors who specialize in nursing home medicine, rather than general practitioners who only visit occasionally. The research analyzed care for more than 417,000 long-stay residents with Alzheimer's and related dementias, finding those treated by nursing home specialists, clinicians who spend at least 80% of their time in facilities, had 7% fewer preventable hospitalizations and ER visits, often tied to conditions like diabetes, heart failure, and infections, which accounted for nearly half of all hospital trips from nursing homes. The study showed the biggest gains when specialist physicians were involved, cutting preventable hospitalizations by 13% compared to general doctors. The number of dedicated nursing home clinicians has surged, growing to greater than 50% in less than a decade, and now they practice in more than half of all U.S. nursing homes. Experts say it mirrors the rise of hospitalists in acute care, signaling a major shift in how medical care is delivered to some of the nation's most vulnerable patients. The Kentucky Supreme Court ruled against a Lexington memory care community in a negligence case, rejecting its attempt to force arbitration. The case involves the Lanter at Morning Point Alzheimer's Center of Excellence, where resident Norris lived in 2020. His widow, Sandra, alleges her husband suffered repeated falls, weight loss, and a stage 3 bed sore while in the facility, ultimately leading to his death 5 months after leaving. When admitted, Sandra signed a mandatory arbitration agreement. The company argued that she had that authority under state law as his spouse and court-appointed conservator. The state's high court disagreed, saying arbitration agreements are not healthcare decisions under Kentucky law. Chief Justice Lambert wrote such agreements are not a medical procedure, not a medical treatment, and not a medical intervention. The ruling upholds lower court decisions, sending the case back for further proceedings. Thank you for joining me for News This Week in Nursing Homes. To get more of Qsource news and info, visit qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your QI needs, call the Q.